So me coming in to maybe interview you to be my pediatrician for my daughter, what is the number one question like these new moms are asking you? What is the first thing that they're trying to find out what they want in a pediatrician? Like what's the number one thing that they ask?
Probably they sort of in general question, they said, what do you feel like, what is your philosophy about child rearing sometimes? Or
Child
like
what?
rearing, like how you can raise your child. Okay,
They ask that?
Yeah, I do.
What's your answer?
Yeah.
That's scary.
Yeah, and then it's a long answer, so I'll do it some other time. But yes, they sort of they keep asking me about what is your philosophy about feeding? What is your philosophy about sleeping together with mom or dad?
Those are great questions, though.
Yeah, philosophy about what's your thought about like being on schedule, as opposed to demand feeding. So especially when the parents come in with as a first mom and dad, and they have a lot of questions, and they just want to focus on how they can take care of the baby during that first 6 months.
And that's great that you're here to guide them, to kind of let them know, because I know I depend on my pediatrician so much. That's something I, really look for is answers, even if it's just an opinion, I'll take it. I'm nervous, I don't know exactly, what I'm doing, so it's nice to hear like a professional that sees babies all the time and kids and and I had tons of questions. They help, through breastfeeding, questions with that, the co-sleeping, the scheduling, the solids, should I feed my child meat, or my child chooses not to, she won't eat meat. So I was freaking out. Is that bad? Is she not getting enough protein, iron? But I could go on and on, but I'll scare you if I just keep asking my questions.
The reason why I brought that issue is taking care of cold and taking care of pneumonia or ear infections, sinus infection, allergy. I think everybody has the same style of treatment, right? Because we all learn from medical school, so that's very simple. And some diseases are very complicated, but we all know how to take care of them.
And that's so comforting.
Yeah,
yes.
but the other side, which is like how to handle the sleeping pattern and how to feed the baby and when to feed the baby, how I can handle this child's behavior. Everyone has a different philosophy.
Yeah.
So
the guidance is so important, though.
Yeah. So you can ask, how would you do for a little 2-month-old baby crying all the time or something? That's kind of, I just throw one example, but and then the pediatrician will explain to you how you handle that. Okay. Then out of that, then you can see how he's going to handle for other problems too.
Exactly. Yes.
Yeah.
I like that.
In that sense, and in that field. I'm not talking about medical disease that we take care of it, but more child rearing type. I
see.
Yeah.
Okay.
So that's what I mean by
okay. I get that, and I like that. That's something as a mother I feel very comforted knowing, that a pediatrician's willing to comfort me in that level of, guiding me.
Yeah, I think it's very important. When I started practice, that I had many moms that would call me, worry about fever and worry about cough and all kinds of different problems, and then I figured it out that their worry is not really the child's condition, but rather, what if something happened? What if there's no one that I can talk to? That was their fear. Yeah. So what I decided to do is like, ma'am, I'm on the phone all night long. I will not go to sleep. So give me a call anytime.
Oh.
Guess what? It never calls me back.
But I love that. That.
Because I'm on call. It's my job. I'm paid for that. So I have to stay awake and waiting for the phone call. I'm not completely awake, but at least that I have to be alert so that I can answer the right way, proper way. So I told many moms that I'm on call and I'll be on my phone, and then you can give me a call anytime if you have a problem. Instead of just go to ER or go to do something.
Exactly.
Instead of saying that, I just said that I'll give you advice. So just give me a call. But at this time that I think that your child is okay, but never know. So or something happen, just give me a call anytime. I answer you.
Wow.
That gives mom really peace.
Of course it does, and as a mother, I appreciate that. That is more than just a pediatrician. That feels like family.
Mm-hmm. So to answer that questions further, that you can ask the pediatrician not only just the administrative part, but also that how the pediatricians are handling all those illnesses and things. Okay, so we do have two different things: disease and illness. They are two different things. Disease is like disease itself. Illness is how ill the child is because of disease. So I think you have to look for the pediatrician who really takes care of child's illness, not only disease.
Okay.
So when we talk about illness, that it can be involved with some behavioral, psychological things, or some stress-related things, all are in there. So I think we should take care of the patient whole being rather than just the disease itself. So that's
I love that.
Illness, right?
Well, that's if I was coming here to interview. Well, I am. Never mind.